Hi everyone, thank you for joining us for On Call for All Kids. Today's topic is the flu. We'll be discussing signs of the flu, how it's different from a common cold, and ways to prevent the flu. I am joined by Dr. Rachel Dawkins. She's the medical director of our Pediatric and Adolescent Medicine Clinic, and tis flu season, Dr. Dawkins.
It is flu season. We are in it.
Why does it come each year?
So influenza is a virus just like many others, and influenza does have a seasonality. So especially during the wintertime, we see the peak of flu season. And actually, most people think the peak is in December, but the peak is actually in February. So we're just getting started with flu season.
And do we know yet if it's going to be a bad year, kind of like we saw last year and definitely the year before?
Yeah, so we don't know yet, but I can definitely tell you we're seeing lots of flu here in our pediatric clinic, and we're seeing flu in our emergency room. So it's definitely hitting us here in the Tampa Bay area.
What symptoms do we need to look for? How do we kind of know the difference between maybe a common cold and the flu?
Great question. So the flu is a virus just like a common cold, but usually when you have a cold, you think runny nose, cough, maybe a low-grade temperature, but generally you can function, maybe go to work, go to school. But when you have the flu, you usually have higher fevers, body aches, chills, and really have a really hard time getting out of bed or even functioning. So you feel really crummy, much different from the common cold. And another misconception is people think that when you say, oh, I feel flu-ish or I had a stomach flu, it really isn't influenza. It's really just another virus that's causing those things. So we have to be careful when we're talking about the flu that it's really influenza.
Okay, so there's a good chance we'll know because we're going to feel pretty terrible.
You feel really terrible. Trust me, you know if you had the flu.
So does that make it a little bit more dangerous? We do hear about deaths sometimes associated with the flu each year.
Yeah, so the flu can be really dangerous. It causes a lot more inflammation of the lungs than your common viruses. Really dangerous in little babies and elderly people, and those with chronic medical conditions such as asthma or maybe cystic fibrosis. But every year we see healthy kids that die from the flu unexpectedly. So it's really important to get vaccinated.
Well, that's my last question for you. So how can we prevent the flu? Number one, get vaccinated.
So the best way to prevent the flu is to get vaccinated. So if you got vaccinated last year, you have to do it again this year. It's important for everyone 6 months old and up to get vaccinated. I hear a lot of times people are worried like, oh, I've never gotten the flu and I've never had the flu vaccine, so why would I get that? Trust me, you don't ever want to get the flu. You feel terrible. And the other thing people say is, oh, I got the flu vaccine and I got the flu. And that's just not true. So you may get the flu vaccine and feel, a little run down or your arm may be sore, but you don't actually get the flu from the flu vaccine.
Is that your body just kind of reacting to it so that it won't get
right.
the flu?
It's your body, fighting off what it's supposed to do. Or maybe you picked up another virus along the way when you went and got your flu shot. The other thing to know is good hand washing. So remember, the flu virus can stay on surfaces. We can pass it through coughing or sneezing or just touching things and touching our mouths. So make sure good hand washing, especially during this winter season.
Okay, Dr. Dawkins, thank you so much for telling us more about the flu. If you have a topic you would like us to cover, you can just comment below right here on this video. And don't forget to check out our website. It's HopkinsAllChildren'sHospital.org/newsroom. Lots of pediatric healthcare information there as well. Thank you for watching. Stay safe and healthy. We'll see you next week.